This is a fascinating example. This is one of the first projects we ever did. Was colonoscopic surveillance in patients having colonoscopy who were at risk of colorectal cancer or adenoma. So these patients with family history, past history, or something making them at higher risk. When we examined these 100 patients, we were flabbergasted to discover that we were sticking to NH and MRC recommendations about 38% or 39% of the time. In other words, we had massive defects in appropriateness. So there it is, that's where we were. So we introduced a system where we put it all, I mean, it seems so damn simple now, but we put it all on a computer and had defined rules, and we would have a nurse who would collect all the information and organise the follow-ups and all this sort of thing. And over years, and it remains like that now, we follow NH and MRC guidelines reliably almost 100% of the time. And there are something like 10,000 patients on this now. It's now actually expanded to statewide, and there are potential international ramifications, because what we have been able to discover, or what we've been able to demonstrate in this group of patients, that interval cancers in this group of screened patients are extraordinarily uncommon by comparison. So we've demonstrated an absolute survival advantage and a decreased survival, but also significantly decreased cancer rate, which has been a remarkable thing that's led now to an MRFF grant to do it statewide, and ultimately I'm suspecting nationally and beyond. But the interesting thing is that we actually brought about a reduction in surveillance endoscopy, because in a significant percentage of patients we were doing it too frequently. In other patients we were doing it too infrequently, and a significant number of patients were being lost to follow-up using routine methods. In other words, come back and see us in 5 years. I mean, you know, who's going to do that? Who's going to remember that? So the secret was to make it reliable, but we decreased the number of outpatient visits, decreased the number of endoscopies, which increased the capacity to treat more people. So it wasn't just about increasing the facility, it was increasing the efficiency of the utilisation.